Thank you, Amber, for coming up with this great idea. And I'll turn it over to you this morning to introduce your team. Go ahead.
Sounds perfect. Well, yeah, at one of our meetings, it was mentioned that people were kind of wondering what it's like, to live in an assisted living, what the next steps are, and that people are a little bit scared and timid, especially because of COVID and other things that have went on in recent years. So we thought about it and thought, hey, this might actually be a good idea to bring in some of the planning options that are going to be for next steps. At some point, myself included, I'm going to have to look at next steps, whether that be in assisted living, memory care community, hospice, in-home care. And planning can be a little bit scary sometimes and different. So we decided that we would all work together on a presentation so there's 3 different organizations working together today. We've got, I'll let them introduce themselves, Agrace, Brookdale, and Comfort Keepers. I'm the business development director at Brookdale Senior Living. I've been there a little over 3 years now, and we'll be doing a presentation today on planning for life transitions, which options are best for you. I will kick it on over to Molly next to introduce herself and her organization.
Good morning, everyone. I'm Molly Dean. I'm a senior account manager with Agrace, and I cover the Madison area and part of Dane County and all of the services that Agrace offers from hospice, supportive care, age at home, and also the new adult day center. And planning for life transitions is something I'm very familiar with as well, because I have parents that have moved down to Madison to be closer to my husband and I, and live over at an independent living community. So we found that this can be very helpful in being able to make decisions for quality of life.
Good morning, everybody. My name is Darian Dalsen. I am with Comfort Keepers in-home care. We provide care within the Madison and Dane County and outside area as well for home-based care and services. I have been the Director of Business Development just under 9 years with the company. Thanks for having us today. Appreciate it.
Well, thank you again, everyone. Go ahead and who's starting, Amber?
Well, I was going to say the presentation itself, it looks like it's ready to be opened in the chat. So if we could open that and share the PowerPoint, that would be amazing.
Okay. Get that real quick here.
And we don't mind questions. I mean, throughout, if you'd like, feel free to also put them in the chat. They will acknowledge them at the end. I know sometimes it's super hard to remember, if you've got a burning question, type it in the chat. We will respond to it either at the moment or at the end. We're very relaxed. We're going to give some different examples today of different scenarios that may come up, some things that you may have already experienced, some things that you may think will never happen to you. But at some point, we all know something's going to happen and we'll have to make a change in our lives. So that's going to be kind of our goal, to let you know what's available and what those different things look like. Molly will be the one that'll start out once we get the PowerPoint up.
Yeah, be just a second here. Let me get my sharing started.
And we'll let you know when the next slide will be needed, Mike.
Okay. All right, so share screen. Here we go. Let's see if I can make this a little bigger. Zoom quit. And I Am I getting any, I'm trying to get this thing larger, but I'm having a little trouble.
No.
Okay, hopefully everyone's still there.
Yep, we're still here.
All right, my Zoom bombed. Okay, where do we go? Let's see if I can. All right, go ahead. I think I
Oh,
figured it out.
we don't have the slides quite up yet, Mike.
Oh, they're not?
No.
Well, oh yeah, I probably have to reshare it again. All right. Well, here we go. All right. All right, how about that? Any better?
Yes, that's perfect.
All right.
Wonderful.
Sorry for the delay. I'm sorry.
No problem. No problem. So today we're going to be talking about planning for life transitions. Which options are best for you? Next slide.
Okay.
So it hasn't moved. Oh, there it is. Okay, perfect. So what we're talking about today is just, why planning in advance is key. And we know that oftentimes, it's hard to, think about planning for life transitions just because, you're thinking, well, maybe it'll never, happen to me. And a lot of times what people focus on is, more, what sort of, planning they want to do for the end of their life. But what we've found is that oftentimes it's even, more important to be able to, plan earlier for any sort of advanced life changes that might be happening. So really it's key to be able to anticipate common aging related life challenges. So it may be that you have a diagnosis for, a chronic illness, and, you want to be able to plan ahead for, as that disease progresses, what some of the challenges might be with it, so that way you can try to avoid, any things that might happen, later that would really impact your quality of life. It also really allows you to be able to have a lot more control over that decision process and allows you to have more options because you're, thinking about, what sort of plan you want to put in place before something happens. What we've also found is that planning ahead can really help in minimizing, stress, financial problems, family strife, and also any health harms that people experience when, those challenges can happen and there hasn't been any sort of planning ahead of time. Oftentimes, what people say is it really gives them just a lot of peace of mind to know that, they have that plan in place and so they can avoid some of these issues that sometimes happen. Also, too, planning can be key in just completing those necessary legal documents and documenting one's plans, preferences, and also values. And we're very lucky, here in Dane County that there's a lot of resources right at our fingertips for being able to put together, say, like a healthcare, power of attorney document. You can reach out to your physician's office. We have the ADRC. We have a lot of different services such as like Agrace supportive care, offers advanced planning documentation services. So there's a lot of ways to make sure that, just that you're prepared, legally with those preferences for what you want later in life. And then we, of course, also, just urge you. Oftentimes people say, well, I did this document, a while back, but I'm not really sure, where it's at, or, maybe things have changed in your life and you want to make some different preference changes to that document. So it's a really good idea to just make sure that you're, reassessing those documents and taking a look at your preferences. So when that time comes, they're updated to, what you're interested in. Next slide.
Okay, so I'm going to take over from here and share this with Mr. Darian. We came up, us three, with the top 10 challenges and situations that we find that people at some point, depending upon, it doesn't always matter on the age, that's going to come up, or that we hear questions asked upon, or situations that develop and arise. So I'm going to touch on the first 5, and then Darian will touch on the last 5, and they're in no particular order here. With that, We're going to start with the first one, and that's sudden decline in decision-making ability during hospitalization or due to an injury. So many older adults and families don't realize that the situation is fairly common, okay? But it truly is. A study published in 2014 by JAMA International Medicine found that within 48 hours of a hospitalization, 47% of older adults required decision help from surrogates. Such sudden loss of mental abilities can be due to an event such as a bad fall, a head injury, or a stroke. It is also sometimes caused by delirium, which is a state of worse than usual mental function that's often brought on by illness and affects about 30% of older adults during hospitalization. Rates are actually much higher after surgery or an intensive care unit. So after delirium, it can take weeks or even months for older adults to recover their usual mental abilities, and some actually never do. And so we're not saying that to scare you, but it is common. Even UTIs we see can cause some mental and cognitive changes. So know that those are normal. Whether that's a friend, a loved one, yourself that's going through these scenarios. So number 2 is difficulty managing driving and transportation. And this is often related to developing cognitive impairment, but also can affect older adults who do not have Alzheimer's or a related dementia. It's because our vision problems and mobility problems become common in older age. The phenomenon of normal cognitive aging can also affect driving ability because cognitive processing speed and reaction times become slower, obviously, as people age. Number 3 is difficulty managing home tasks and home safety. So home tasks include things like maintaining the home, preparing meals, and grocery shopping even. So problems doing these activities can be due to cognitive difficulties, mobility difficulties, or both. Home safety can be an issue if a person with dementia wanders or leaves the stove on. Many older adults are also vulnerable to falls, which can easily become problematic for older adults who live alone and may be unable to get up or get help after a fall, especially if an injury is involved. So research has shown that 50% of people will need a high level of supportive services for some period of time in late life. So that just to be able to kind of expect that at some point these services will be needed. Number 4, difficulty managing finances and vulnerability to financial abuse. So these are especially common when an older adult develops cognitive problems. Research has found that financial difficulty is often the first signs of emerging Alzheimer's or another dementia. Research also indicates that financial abuse of older adults is extremely common, with billions of dollars lost each year. This may involve strangers attempting scams or others actions meant to take financial advantage of a vulnerable older person, but it also often involves questionable or frankly illegal activities committed by family members, friends, or others in the care circle. And I know that sounds scary, but I know Molly, Darian, and I will say we've seen it. So completing POA forms, which is power of attorney, for the banks and other financial institutions involved in your assets and affairs. And the why for that is that banks and other financial institutions often will insist on the use of their own internal power of attorney forms before allowing agents to access information or conduct transactions. Okay, they may also resist a POA form that is too old. So it's important to note that it may not be entirely legal for them to do so, but in many states, it remains common for banks to resist legally drafted power of attorney documents. Families can save themselves time and hassle by obtaining institution-specific power of attorney forms, while an older adult still has the capacity to complete them. So simply simplifying finances and accounts beforehand will make this process much, much easier. And then 5 is Alzheimer's and related dementias. So when we're looking, experts estimate that about 25% of people aged 85 years of age or older have dementia, with the risk of dementia increasing rapidly as people reach age 90 or older. The possibility of developing dementia is perhaps the most important challenge that older adults should plan for because it has profound repercussions for financial safety, impact on family caregiver safety at home, and of course, the ability for the affected person to make decisions. So once mild dementia has developed, conversations about their future and delegating authority to others become much more difficult than they would have been before. Okay, and these conversations are not easy, even when the older adult has good cognition. In the absence of a durable power of attorney documents, if an older adult develops Alzheimer's and loses the thinking abilities needed to soundly make decisions related to health, safety, and management of one's affairs, families, and often other documents, then the families are going to have to resort to seeking guardianship, you guys, in court. And this is very expensive and a difficult process for families. So it's much better to avoid it by having planned ahead and completing the necessary legal paperwork ahead of time. Next slide, please. And I will lead this over to Darian.
Number 6 would be managing chronic health conditions at home. And, a chronic health condition, as an example, would be something like congestive heart failure. And when people are first diagnosed, they're managing it at home and going through that process. And part of this is when you're at risk of having additional chronic health conditions when you're first diagnosed with one. So you could have a diagnosis of congestive heart failure, as an example, and then within a year or two, unrelated to it, start to have symptoms of dementia. And so one of those situations are, so you have congestive heart failure as an example, and then you're experiencing dementia, which becomes more challenging to manage that congestive heart failure. So that becomes a bigger challenge for people. And many times we see that they're unable to manage their overall health because of multiple things going on. And it may not just be dementia, it could be another chronic health disease. It could be something like diabetes, as an example. And then number 7 would be, many times we see couples, and especially the last 10 years or so, couples are staying together and are supporting one another, but a situation where a primary caregiver then gets sick. There is a higher propensity of the primary caregiver getting ill or being sick or being hospitalized. And what happens then? What's a plan B when the primary caregiver, whether it's a spouse or an adult child, ends up having a health issue and goes to the hospital, or just even simply is sick? What happens in 4 or 5 days like that? Or an adult child gets a job in a different location, or their spouse gets a different job in a different location. Moving components of this, and I touched on that a little bit, but it could be the person moving, and many times Amber and Molly and I would talk about this, where people are adult children are having their parents move to the area that the child lives in. So it's readjusted, being able to find out support networks in those areas. A child may have lived in Madison all their life and then moved to Seattle, Washington, and then now the parent moves to Seattle, Washington, and has only been there as a visitor, but now as a resident there, and having to learn those networks. Social isolation. We all experienced this during COVID, but in general, older adults have a higher percentage of seeing social isolation than other people. Their loved ones have died, their friends have died, or moved, and now they have less social interaction, and over time have more social isolation, which when you have that, many times then you're not necessarily able to really see some of the health conditions that may change with you when you're more isolated that way, where another person coming in and visiting you may see that. So children out of state, this is becoming more common as well. Like I said before, a child lives in Seattle, Washington, and mom and dad live here in Madison, and being able to try to manage that. That's many times a phone call that you can get, and you're, because a child is concerned about a loved one and being able to go. So it's being able to talk about this ahead of time, and how do you navigate through that, and what's your plan, what's your steps. Next slide, please.
So we talked about, some of the reasons why, planning for life transitions is important and some of the specific situations that people may be running into that may be challenges. And now we're going to be talking about, well, what resources are available in the community to be able to assist with people going through these life transitions. And we always say it's better to have this information before you need it. So then that way you can make the appropriate decisions based off of your needs and also your preferences. So one of the resources we're going to be talking about today is the Agrace Adult Day Center. So this center opened a little over a year ago. And the reason for it is really a place for your loved one, while you're either at work or if the caregiver just needs a respite from caregiving. So it's a safe place. It's open Monday through Friday from 7:30 a.m. to 5 p.m. And it's for anyone who either cannot be at home alone during the day safely or just doesn't want to be, and often for seniors with dementia, cognitive decline, or memory loss. So they can come during the day. It's an opportunity to be able to make friends, talk to people, have companionship. We serve 2 meals a day, breakfast and lunch with our on-site chef. And there's an opportunity for physical activity. We do morning exercise that's seated, as well as also other mentally stimulating activities just to, have a lot of fun during the day. Next slide. So the Adult Day Center is unique because we do have a medical model there. We have an on-site registered nurse manager. So that allows us to be able to administer medications to our clients while they're there, as well as also an activity coordinator, our trained caregivers, an on-site chef who prepares delicious meals. And then also, we wouldn't be able to do all that we do without our wonderful Agrace volunteers. And they're also there to be able to do activities with our clients and also do some one-on-one. So it's it's a beautiful space. It has a 50s era diner. That's where we serve all of our meals. We have our activity and exercise space where we do seated exercise, like things like chair yoga and stretching and meditation. And then we have our very own movie theater. And that is where we always have our afternoon movie. Next slide. So here's a picture of what the exterior of the Adult Day Center looks like. We also do have some additional services that are available for our clients. So we do offer showers with our walk-in shower, as well as also we have a nurse practitioner that comes out twice a month to be able to do foot care. And it is conveniently located centrally in Madison by the Beltline. So it's over kind of by Steinhoffels, in between Culver's and Rocky Rococo. And it's right off the Beltline. And it's $85 to $95 a day, depending on the level of care that's needed for our clients. Next slide. Here's a couple more pictures. There's our 50 style diner that's on the left-hand side, and then our activity and exercise area on the right-hand side. Next slide.
All right, so I'm going to take over from here, talk a little bit about Brookdale and different options, because that's what I can speak to the most. I know a lot of the different assisted living communities in the area, and you'll hear different terms as RCAC, CBRF. You'll hear all sorts of different items out there, which can be confusing. So we want you to know that we're resources here to answer questions. But I love this slide. This was a Brookdale made slide, and it's talking about enjoying the journey. So your journey through life is going to be as wonderful as you choose to make it. Okay, so age doesn't change that essential truth. And though your needs may change as you travel through the decades, you can feel confident that you won't have to make the journey alone. And that's why we're doing this today, is so you can know that you don't have to do it alone, that there are good people out there to help. So as in anything, most of the situations we face in life, we have a general understanding, that something has to change at some point in our life. in the situations that we're in. We can't just sit idle and not do anything. So this could involve, obviously, the transition to a senior living community, whether that be apartments, assisted living, memory care, securing services, as Darian and them offer with home health care, Molly and them offer adult daycare, hospice, or gaining additional support from family members or friends. So once a person realizes that a change is needed, the next step is to help, obviously, someone understand why they should make a decision sooner rather than later. And that's why we're doing this. Sooner rather than later is key to seeing things. And I hate to say this, but Darian and Molly would agree. A lot of the times during COVID, we saw folks going from living at home in their own house, no assistance needed, to something happening and they bypass in-home care, assisted living, and all the options go right to skilled nursing, which that's a transition. And so we're not saying that to scare you, but the sooner you can, make some decisions, you have more options available to you. So I'm going to go into Brookdale's specific responses to questions we often hear from people as they're starting to look at assisted living and memory care options. So let's go to the next slide, if we could, please, Mike. So I've narrowed it into 8 common questions that were asked with concerns. Okay, and kind of our own response, because I can't control what's done at other assisted living communities or know how they handle things, but I do know how Brookdale does. Okay, so with saying that, we have personalizing to patients' needs and diagnosis. Normally we hear people questioning, what does that look like in assisted living? What, how is that handled? And Brookdale's response is, that we will be giving personalized care to patients with their specific needs and diagnosis. So we offer clinical support and resident education around the most common 11 chronic conditions, which include things such as diabetes, Parkinson's disease, cancer, depression, heart failure, wound care, COPD, bone and joint conditions, and stroke. And just so you're aware, we do offer a monthly Parkinson's support group that's free to the public, and it's a hybrid approach. So it's in person at Brookdale Madison West the last Tuesday of the month from 1 p.m. to 2 p.m. And it's also held on Zoom. So feel free to, if you know somebody that needs that, keep us in mind. Also, we use an assessment process. Okay, so people wonder, how do we determine what assistance is needed? So we developed a customized personal service plan for each assisted living resident. We also apply a uniformed approach for various conditions, including diabetic management, special dietary requirements, COPD, incontinence, and dehydration, so that the physicians we partner with know that the patients are receiving consistent care from trained staff. So once a resident's personal service plan is in place, we'll monitor the quality of care that is being delivered. We have a protocol for our health and wellness directors, 65% of whom have been with the community at least 2 years, which governs viewing quality outcomes in real time by monitoring fall management, urinary tract infections, so UTIs, and timely medication administration and skin conditions. We also have electronic documentation reporting capabilities to share metrics on quality outcomes with our residents' healthcare team, including vitals and weight management. People will often ask questions about, well, what does assistance with daily living look like? You also hear ADLs often used with that. Brookdale, it uses a person-centered care, which drives our programming and services plans. So we can individualize plans to a person's needs. So one of our top priorities is to find the ideal community for someone with the right level of care for that person. We do this in part through our personalized assessment process. So we have licensed nurses conducting detailed assessments and reassessments as necessary to maintain service plans, okay, that match residents' unique needs. Assessments happen prior to a move-in, so we can help potential residents pick the community best suited for their needs. And we have communities all across the nation. So with doing that, we consider many aspects of the resident's life, such as their mobility, dietary restrictions, medications, and diagnosis. This helps give the resident and their family peace of mind that their needs have been identified, and then the assessments continue for their entirety of the resident stay with us. They're repeated, okay, on a regular basis, or sooner if there's a condition that's changed. Assessments are important, okay, anywhere you go, as they're the foundation for identifying preferences and the level of clinical care and support required. So we embrace at Brookdale proactive whole person approach to care, as well as other non-medical interventions needed to help maintain or improve an individual's health. So our Optimum Life program, which is based on 6 dimensions of wellness, is really moving into our resident engagement signature programs, which are individualized service plans to help inform collaborative care reviews and partnerships with healthcare providers while helping residents meet goals, maintain independence, and try to avoid unnecessary hospital stays, okay? And then we go on to high risk specialized conditions like Alzheimer's and dementia. So at Brookdale, we've created specialized environments with attention and support for high-risk conditions like Alzheimer's and dementia. It's person-centered, research-based program specifically designed to help people with dementia have a better quality of life and live with dignity. That's important. So at Brookdale's Clare Bridge communities, dementia care has evolved into a much more personalized experience. Patients are assessed and placed according to clinical and psychosocial needs. The right level of care ensures the right programming is provided to enhance quality of life and minimize unnecessary transfers to higher care settings. So the programs are individualized based on each patient's cognitive abilities. Even our dining, okay, is individualized to the patient's cognitive abilities, preferences, and nutritional needs. Juliet Holtklinger is our gerontologist for Brookdale Senior Living. And she says that the evolution came out of an understanding, okay, that people living with dementia need distinct support. Techniques that work for one resident may not work for another. And instead, the care partners at Clare Bridge are trained to provide individualized care. They're also trained with behavioral intervention tools and to exhaust every other resource before they turn to psychotropic medications. So our goal is not to turn to medications. Our staff is focused on reducing the use of these drugs by our residents at Brookdale. We support the person-centered relationship between the care partners and the residents. Our practice in Clare Bridge is to have a consistently assigned care associate whenever possible who knows the resident's history, routines, and preferences. This helps bond and provides residents with a sense of stability and the comfort that they need, that they're well known where they live. This comfort's not only result, it's often a sort of reawakening in a well-intentioned effort to keep those with dementia safe at home. Family members or at-home caregivers sometimes, and I'm not knocking them, restrict what the person can do or be exposed to in the name of safety, okay? So they might be kept inside more, might not be allowed to do things that they used to like to do, like cooking or household chores. So Juliet Holtklinger says the approach may do more harm than good. It's one of the main reasons Brookdale takes this sheltered freedom approach. Then we go to financial cost. So I'm covering, like, I'm doing an overview, you guys, on all these topics, just because these are questions we often hear. So as questions come in, feel free to write those in the chat. Financial, strategic, personal. So senior living can be more affordable than one may think or expect. The cost of the status quo often isn't much different than an adequate senior living solution. So even if senior living is more expensive, it often promotes a better quality of life as well as peace of mind for family members. There are financial support resources available to subsidize the cost of senior living. Making the transition to senior living, this is a big one because it can be easy for
Amber, let me
Yes.
jump in there real quick. There was a question
Yeah.
about insurance or Medicare. Who pays for this? Are there, yeah, I mean, I was listening to
Great.
adult daycare, you know, at $85 a day, you know, if you use that every day, the family's gonna go bankrupt pretty quickly, right? I mean, that's expensive. $85 a day. Wow.
That is a wonderful question. Molly, should we answer this now or do we want to answer it at the end?
We can answer it now. So we understand that, that each of the services can be, paid for in different ways. So, so that was a great question. As far as like the adult day center is concerned, it can be paid for, privately. It also can be covered by long-term care insurance. Our adult day center also received its license. So we're going to be negotiating contracts with some of the managed, care organizations as well. So sometimes like some of those, managed Medicaid plans would be able to be taken by the adult day center, as well as also there's the Alzheimer's Dementia Alliance. So if somebody does have a dementia diagnosis and meets other financial criteria, they also have funds that would be able to cover things like the adult day center and also to the services that Darian's going to be talking about as well with in-home care. I'll turn it back over to you, Amber.
Perfect. I can answer the question in regards to assisted living, memory care, communities, in specific. So there are private pay communities. There are also those that accept Medicaid right up front, which we are not one of those that accepts Medicaid right up front. So private pay would be using assets that you've gained over the years, your savings, selling of a home, long-term care insurance is a big one. So if you've got long-term care insurance, that's something to look at. One thing that I say is ask a senior living community, will they take at some point when finances run out? Will they accept Medicaid? So that's something that you'll want to look at as well. So making sure you have the right questions, but those are the primary ways. Family members will help as well. We'll see that different times too. So those are the ones that I think of right now. Darian, Molly, any other ideas in addition?
Yeah, I mean, I can add to it that when it comes to the question about Medicare versus Medicaid, too, just to clarify, with Medicare is health insurance for typically an individual over the age of 65. There are stipulations that people less than 65 due to ability or disability are able to qualify for that. But typically with Medicare will cover what is in, and I was going to cover this in the home care component, but they'll cover a certain amount of the home health piece of it. And home health is when you end up, if you go to the hospital and then you're staying there for a specific length of time, you go to rehab, or you go home and you have a home health provider, which will provide possibly physical therapy, occupational therapy. That is covered under Medicare for a specific number of days, where typically home care is done through private pay, but then also long-term care insurance and Medicaid providers. There's in Dane County, there's managed care organizations, and then there's Iris. Those are the two typical Medicaid providers. But when you're coming to the cost, there question about $85 a day. There is a cost that is associated to it. I mean, you're looking at, if you did it for 20 days in the month, it would be $1,700 for the month to be able to do that. What I would encourage people to do is, just like with anything else, is developing a plan. And you don't have to necessarily do 5 days a week. It's what will fit into what your need is. And will the financial cost, will that be a burden, and how then do you work through that? And that's where you utilize other resources to figure some of those out, because many times when people will get into situations and they're overwhelmed by the cost is when they're in the hospital and all of a sudden somebody comes to you. You don't know who they are. They might be a social worker, they might be a discharge planner, and says to you, well, mom or dad or you need 24-hour care. And the first thing, and people go, oh my gosh, now we have to move into assisted living, or we have to have somebody there with you all the time. And it becomes overwhelming very fast. And really it's figuring out what that need is and what that is And exactly, as a person sleeping overnight, because a hospital is the highest level of care setting you can be in. It's the safest, or one of the safest environments you can be in from a care standpoint. So they're going to tell you, yes, you need to have this level of care, but what does that really mean and broken down? But typically, Medicare does not cover, Medicare will cover hospice services, typically 65 or over, or there's cases below 65, but typically the services that hospice will provide other than daycare are provided by Medicare. But I know it's a long-winded answer, but it's a lot of information, but it's a complex situation. It's not just an easy, this will cover it or this will cover it.
Thanks, Darian. And also, before I forget, there are partners out there like Patriot Angels, that is for veterans who have served and their loved one. And then also veterans benefits as well. So check with the VA on what benefits you have available. We'll definitely answer more questions at the end. I know we had a late start here, kickstarting the meeting. So hopefully everybody's prepared to sit around a little bit longer to listen to us. I'm going to jump back into making the transition to senior living, which can be easy for some, as I said, but very hard for others. So we find that taking a proactive approach is the best way to go, because it can allow you to make the decision without any negative influences, which are urgent health needs from a compelling event. So making a decision early can allow the prospective resident to be an active participant in the decision-making process. That can be some of the hardest parts when someone is not prepared. Then everybody's trying to make a quick, rash decision and you don't have options. Allow yourself to have the options. There's waiting lists, okay? Being on a waiting list is a lot easier than not knowing and not having looked to where you have to move if it comes down to it. So starting the process early provides more time for understanding and evaluating available options. Transitioning to senior living provides many benefits, though, to someone looking at it and their loved ones. So the resident can get better care, more social interaction, and still generally maintain an adequate level of independence. And family and friends can visit regularly to spend time with their loved ones instead of traveling back and forth to provide care and support. They can stop being the caregiver, which can also help. They'll save time with peace of mind that their loved ones' needs are met 24/7. So then we're going to go into patients or families' denial of care needs. So this is having the appropriate level of care can make all the difference. So at least in regards to what that process looks like with Brookdale, for example, when someone's being discharged from a skilled nursing facility after a fall, a serious illness, a broken bone, weakness, etc., a discharge planner is first going to contact us to schedule an assessment. Okay. In most senior living communities, this is what it looks like, but I can only speak to Brookdale's. Second, we'll contact you with your healthcare provider in the hospital if needed to determine together the ideal transition for you and exactly which of our communities suits your needs the best. So we have 4 communities here in the Madison network. In locations in Middleton, Madison, and Sun Prairie, and Brookdale can help with a large range of patient care needs and managing conditions. This process can help streamline an often stressful process for patients, families, and their primary care provider, okay, by providing a single source of communication and a seamless patient transition if that's what's decided. So infrequent consults with experts in our senior care management team. So residents, family, and social connections are part of our service plan as well. As you're aware, studies have shown a strong connection between social interaction and the mental and physical well-being of seniors. We talked about social isolation earlier. Consistent human contact can reduce stress, as well as the risk of depression, which occurs in more than 2 million of the 34 million seniors in the U.S., according to the National Institute of Mental Health. So at Brookdale, we're countering this trend by encouraging and supporting our residents to nurture their existing relationships and expand their social circles. If they have to manage daily care needs, family caregivers may be so consumed that they miss out on providing social interactions for their loved ones. So with fitness classes, art workshops, clubs, and devotional services, we help our residents stay socially engaged. And our residents' well-being is at the core of everything we do. Safety, people often ask about safety in assisted living, which is very important. Brookdale's approach to it is health, safety, and well-being are our top priorities. So we provide cross-functional support with clinical and operations expertise to implement proactive measures for residents and associates. We're the largest employer of nurses in senior housing with over 6,000 licensed nurses. In regards to attentiveness and care, Brookdale's culture is based on servant leadership. And so with us, our associates are the key to attracting and caring for our residents. So Brookdale's mission is driven business that's the ability to serve approximately 60,000 residents every day. And we want to enrich the lives of those we serve with compassion, respect, excellence, and integrity. So we say that serving people is how we live our best lives. And so we'll go on to the next slide there. And what it looks like real quick, we've got dining amenities, events and activities and living spaces. People often ask, what is it going to be like in an assisted living, especially if they've not visited one? They may have went to one in the past with a loved one when they were scary. Very small rooms, or maybe someone went to a skilled nursing facility in a smaller town. I remember my grandparents, and it was very scary. I wouldn't want to go there myself or put my dad there. So if you have not seen one, it's always nice to go look. For dining, so eating well is part of living well. And we know that at Brookdale, but anywhere you go, make sure the dining program has talented cooks, fresh and flavorful ingredients, and a rotating menu. So you have features and entrees and desserts with variety, as well as snacks, coffee, tea. But above all, beyond the food on the plate, also you want to have an atmosphere that's warm and inviting. So dining rooms that inspire you to linger with your friends longer, even after you've cleared your plate. Amenities, you may be surprised about the amenities available at different communities. So while the features vary from location to location, you can find everything from beauty salons, on-site barber salons, cafes, clinics. You get your mail delivered there. Some of the amenities are designed to provide with fun and recreation. So there are pubs there. There's on-campus cafes for coffee dates. You can gather in the game rooms. There's libraries, TVs. You can do trivia. There's general stores to pick up necessities. And then there's travel as well. Like our communities have buses that will do bus trips, events and activities. So what would a community be without something fun to do? So no matter what community you choose or where you choose to call home, you can find fun-filled calendars of activities. Make sure you ask to see an activities calendar if you're going to tour different communities, because there's happy hours, trivia nights, local excursions. People can take you to medical appointments. Make sure you ask about all those. And then living spaces. You want to make sure that there's areas that you can socialize with new friends, so you can enjoy meals on campus. Also, you can take a break and get some alone time. So retreat, you want to make sure that your apartments are spacious and light filled. And then go look at the variety of floor plans, because a lot of places like Brookdale's, you can personalize your space. You can hang your TVs up. You can paint your walls. So you can also bring your pets to our communities. Not every community can you do that. And make sure that you ask if they do person-centered programming, okay? Because that's vital and can be utilized in a community setting or even in a home-like environment. And I know that Molly and Darian will speak to the fact that they do person-centered programming as well. Next slide. And then basically, the last thing I'm going to really talk about in these last two slides is whether you're wanting to build your physical strength so you can spend more time playing or staying mentally sharp. Make sure that you look at communities that have different programs available to you. Like we have Optimum Life, which guides our signatures, which are programs and offerings that are exclusive, and they're available at Brookdale. We use a holistic perspective, and we want to help you with the 6 dimensions of wellness, which is purposeful living, emotional, physical, social, spiritual, and intellectual, which will obviously keep you engaged in all of those different ways. And then the next slide there is going to talk about our location. So we have Brookdale Madison West, which offers assisted living. We have a unique crossings program there. And I like to brag about this. So there's only 2 in the entire state. And That's one's in Milwaukee and one's in Madison. And it's a stepping stone between assisted living and memory care. So there's all these new, old, different buildings, but nobody offers what we have, which is the Crossings program there besides Madison West and in Milwaukee. So if someone's not quite ready for full-on memory care, but they need a little bit more safety and aren't quite independent, it's a great spot for someone to go because there's lots of folks there that are still communicative, playing games, there's special programming there. And then they offer the Clare Bridge Memory Care. Brookdale, Middleton, Century Avenue is solely assisted living. Brookdale, Middleton, Stonefield has our Clare Bridge Memory Care program, as well as our Sun Prairie location, which is Clare Bridge Memory Care. And there's just a photo of the entrance of our Madison West community. So I am going to hand on over to Darian to talk about Comfort Keepers. So next slide, please.
Oh, okay. Well, just to clarify too, I briefly talked about this before, but I'm going to talk specifically about home care. And there is home health, and that is a Medicare benefit. Home care specifically is not a Medicare benefit and is not covered by Medicare. How people pay for the service is through private pay, utilization of long-term care insurance, or various Medicaid programs. So just to be able to go and distinguish that. But home care is typically utilized when your health condition is changing, or is limiting your ability to independently do what we call activities of daily living. So it's going to be to be able to regularly shower, regularly getting dressed and undressed. You end up going into the hospital and you've been there 4 or 5 days and you have a fracture, and now you are needing help getting dressed, and it just becomes much harder to be able to get dressed. So it's specific to what your needs are. There's two components typically to home care. There is the activities of daily living, and then there's the light housekeeping, but those are the two in general. So it's being able to help maintain some of those things that are harder for you to be able to do in your home. Home care can provide from 1 hour a day up to 24 hours a day of service and it's based upon what your need is. What we do and what Amber and both Molly have talked about is the utilization of person-centered care. We specifically use a plan of care. So when we're sitting down with somebody, it's really about what the person is looking for and what the needs are. Now, when someone comes in to do an assessment, they might see many other things that you potentially may need, but we're really going to focus on what your needs are. So it's person-centered that way. We're not there to impose our viewpoints necessarily. It's really what you want and what your goal is. But you can utilize the service for as really long as you want. It can be short term. It can be a couple days, up to people have had the service for multiple years. I work with many clients who have had the service for 3, 4, 5, 6+ years. So home care is, the piece of that is being able to, if your desire is to stay at home and to be able to be there, is to be able to create a system that enables you to be as independent as you can. Many times people will say, well, I don't want to be dependent on something that way. So next slide. That and home care services can be utilized after a hospital stay if you need to rehabilitation. A lot of times when you're coming home, and you can utilize home health services and you can use home care at the same time. There's nothing wrong with that. A lot of times people will utilize home health and have a physical therapist, as an example, come in 1-2 times a week, and then have a caregiver come in to be able to help in those other days with various things. Chronic health conditions. So it's a lot of times it's the initial diagnosis. You're able to independently manage those, but as time goes on, being able to help manage some of those things, whether it be congestive heart failure, dementia, COPD, diabetes. Again, home care doesn't mean that you're no longer independent. The way I view it, and I'm biased, I look at it as a way to enable you to be more independent, is that you are utilizing the service for really what you need at that time. As an example, laundry. Some will say, "Well, I can do the laundry, but it takes me 3 hours to do one load of laundry." Well, or maybe takes them 6 hours. You can have a professional caregiver come in and help you do 1 or 2 loads of laundry in that time frame. And also, if it's physically more taxing for you. So if you're starting to see that I can do the laundry, but I'm exhausted after I get done with that load of laundry, that's really an indication when you should utilize services. A part of this is being aware of what your goals are and really establishing those goals, and having a level of humility, and really of outlining the goals with your spouse, your family, your friends, and so that everybody around you knows what those goals are. And moving from home into an assisted living facility like Brookdale is isn't necessarily, people are afraid to do that. It's not necessarily a bad thing to be able to go from home to into an assisted living facility. It's something that you may need because you're not able to manage some of those symptoms anymore at home as well. The examples of home care services can be all the activities of daily living, whether it's bathing, showering, dressing, undressing, helping use the bathroom, light housekeeping, laundry. I use as a comment. It's a common request that we get. Meal preparation. Now our staff are not they're not trained specifically. They're not chefs, so but they're able to just do basic meal planning with you. Transportation to doctor's appointments or grocery shopping. So you're finding it harder to be able to drive, but you still want to go to the store. The caregiver can drive to you, with you to the store and go with you. So it's really specific to what your needs are. Next one. Go ahead, Mom.
Thank you, Darian. The last service we're going to be talking about today is hospice. So a lot of people ask, when is it time, to and what is hospice? And hospice is really a unique blend of medical, emotional, and spiritual care. So we really look at the whole person. And a lot of people ask, how do you end up, having the criteria for hospice? And we say that 2 physicians have to say that with someone's terminal diagnosis, that they wouldn't be surprised that that person may potentially die within 6 months. And they also have to have a goal of comfort, where they want to really just focus on comfort, pain management, and not looking to cure their terminal illness. Next slide. So a lot of people think that, when hospice, comes into the picture, that means that they have to go somewhere to be able to get that service. And, what really happens with hospice is that hospice actually comes to you. So we come to wherever you call home. So that could be like your private residence. It could be your apartment, your condo, the nursing home, an assisted living, anywhere. We've even come to people who don't have a permanent residence and are living in a hotel. Hospice comes to you. You don't have to go anywhere to get it. Next slide. So when should you call Agrace? The number one thing we hear in hospice care is a lot of our families tell us, we really wish that we would have called you earlier because we didn't realize, how wonderful that extra support was, and that we'd be able to get that support in the home. So that way, our loved one could continue to be at home where they want to be. So these are some of the things to just keep in mind. If there's someone that you love is starting to exhibit some of these signs, It could be weight loss. They're starting to lose weight and they don't know why. Could be that they have trouble breathing on a more regular basis. You've noticed that they're starting to go to the ER or, have more frequent hospitalizations. They may be falling more often. They may just suddenly have not a lot of appetite and are having difficulty swallowing. You've noticed that they just really have a lot of, fatigue. They have, a lot of lack of energy. They're getting more weak. You're noticing that they're sleeping more. They're having pain that's uncontrolled. They may also start to have, multiple skin sores that aren't healing or have some wounds. And then you're noticing that they also need help with most of those activities of, daily living. Next slide. So what is it that hospice provides? So you will have home visits from your Agrace care team, and we'll talk a little bit about more of who's in that team, but you also get specialized medical, emotional, and spiritual care right at home. So hospice will help in managing your pain and symptoms, and in particular, where we have specialty care in that for people that are end of life. We also offer grief and spiritual support, not only to our patients, but also to their family members. We offer education about what to expect on this end of life journey. And that's really important because we only have one opportunity to do this right. And we want to make sure that we're really honoring each of our patients' wishes and preferences. We also provide education for the family and caregivers, oftentimes too, on how to care for somebody at end of life at home. And then also too, we provide medications associated with someone's primary hospice diagnosis and for pain and symptom management. We offer DME equipment. That's really important because, like, for our patients at home, they may need a hospital bed or a wheelchair or an over the bed table or a shower chair, things that allow them to be able to stay at home. Hospice can provide, as well as also other supplies such as incontinence supplies or wound care supplies. So that's taken care of by hospice, as well as also too, for those caregivers, we offer short-term inpatient care if someone needs it, as well as also respite care. So someone can continue to stay at home, but their caregiver may need a break. Next slide. So the hospice team, we include a registered nurse, a social worker, certified nursing assistant that can come out and do things like provide a shower, help somebody get dressed, or feeding assistance. Our hospice physician or nurse practitioner, although we do not, we continue to work with our patient's primary care physician, so we don't replace care there. We also have a spiritual and grief counselor that will be there for both the patient and their family. And we also do follow our families for a year afterwards. Interpreter services if needed. We have wonderful volunteers that will sit vigil with people at end of life, as well as, of course, your primary care physician, family and friends. And then if somebody is living in a long-term care community, we collaborate with their staff. And then, of course, your faith community. Next slide. So who pays for hospice? So hospice, as soon as you turn age 65, Medicare automatically pays for hospice through the hospice benefit, as well as also Medicaid pays for hospice, private insurance, and then since Agrace is a nonprofit local organization, we also have our Agrace Care for All program. So that would cover hospice services for anyone who does not have coverage through these other sources. So, a lot of people worry about, like, I don't want to burden my family with any additional bills at the end of my life. But with hospice, it's really covered through Medicare and Medicaid. So there's very little out-of-pocket cost, no large bills for anyone to worry about when they're gone. Next slide. We also offer at Agrace, because we do have our general inpatient units both in Madison and also Janesville. For example, if somebody needs short-term acute care, which would be like a hospital level of care, instead of having to go to UW Hospital or St. Mary's, if somebody is on Agrace services and they need that acute symptom management that can only be taken care of at a hospital and not at home, they do have that option if we have an open room at one of our inpatient units to send the patient there instead. So that would all be covered by Medicare, just like if they were going to the regular hospital. Next slide. And then we also do have patients, that do want to come over and live at the Agrace residence instead of being at home. So that is also an option. We do have large private rooms. We do have our hospice staff there. So this would cover, your hospice care would be covered by Medicare, but this would be private pay if you chose to come and live at the residence because it was not because of a hospital need. So that would be private pay. We also do have our hospice memory care suites. We have 12 beds in Madison as well. Next slide. Any questions at all for the group for Darian, Amber, and I on any of the services that we talked about?
These are just some top resources that we picked everyone to take a look at with preparing to care for planning guides, help support financial resource tools, the ADRC, Newbridge, our websites, Better Business Bureau. We chose that one because they do different senior scam presentations often. Then there's an advanced directives form that you can find online, and then always contact your local senior center. They have a lot of resources.
This Amber did upload this to the chat box, so you should be able to download this presentation and capture this last slide if you wanted to. Okay, well, I guess I've stopped the sharing here. What kind of questions do we have?
I see one in the chat. It looks like how to arrange an assessment. May I ask it which kind of an assessment would that be for? Would it be for the adult day, assisted living, in home? Assisted living. All you'd have to do is you can contact me, basically, and then I would get you in contact with either Bree, Heidi, or Randy, and then they would get you connected with our nursing team to do an assessment. And I will provide the contact information here in the chat for you to call me. And if we're not able to help you based on care need, you can always know that we will refer you to someone that we know can meet your needs. So that is my direct contact information there in the chat.
How many hospice organizations or facilities, service providers are there in the county?
That's a great question, Mike. I don't have an exact number of, of how many hospice agencies are. Agrace would be, though, the original hospice that started in Dane County over 40 years ago. And we are the nonprofit local organization that started, that was originally called Hospice Care, Inc. So for a long time, we were the only hospice in Dane County. And then there are some other national hospices that have come in more recently into Dane County, but we are the one that is the original nonprofit. And we did change our name to Agrace just because there were some other hospice organizations, but we are the largest hospice provider in all of South Central Wisconsin.
That's what I think of, when I think of hospice, I think of, it used to be hospice care, now it's Agrace, but I really haven't heard of any others. Is there a shortage of these types of services, like in-home care, Darian, or, there are plenty of, it seems like plenty of places trying to sell senior apartments, but, what's the staffing situation like for Comfort Keepers?
That's a good question. Staffing, I've been in healthcare since 1999. So my first statement always is that staffing has always been challenging. Whether it was 1999 or 2019, it's been challenging. But when it comes to staffing, what we're finding is the care level and the complexity of this is all answered is the care level is gone up significantly. And this is a conversation that Amber and Molly have had, quite often because we're all seeing it across, whether it's in hospice or assisted living or in home care. And the number of caregivers, we have the most caregivers that I have ever, that have ever been at Comfort Keepers, and we cannot meet the need. So it's just due to that. So we're in search always of caregivers, but it has become a real challenge to be able to meet the needs of individuals consistently, being able to have the caregivers because people's care needs are going been much higher. People are also staying in service for a much less period of time, and I can't speak to assisted living or to Molly in hospice, but we're seeing people. When I first started, people would be on service for a year and a half and have home care, and now it's a couple of months has become the new average for us. We still have longer term clients, but yeah, staffing is challenging. We're very fortunate to have UW and Edgewood College here, so we do have a lot of nursing students and social work students that come in and are able to work with us. I mean, really any students, you don't have to be a nurse or a social work student to do that. But so we have the advantage of that. So we have a different demographic of people. But yeah, it is a concern that we have, and we're not able to always take everyone that calls us. So I would say I would love to have you call and we'll automatically get you set up for services within a day or two. We used to be able to do that, where it's not as easy as it once was. So I hate to paint a grim picture here at the end of it, but it's the reality of what services are today.
Sure. Thanks, Darian. Please, anyone else, unmute yourselves and jump in.
And Mike, I can address just like the staffing question as far as like the adult day center and hospice. We're currently still accepting new clients over at the Agrace Adult Day Center, and also, of course, with hospice as well. And we would come out to assess someone for hospice within 24 to 48 hours.
I know I heard that, there are some high school students who are very serious people. They're getting their CNA license and working weekends at some places. And I thought, well, geez, I wasn't nearly that ambitious, when I was a kid. I mean, are you hiring that type of CNA for part-time? Is that common?
That would be wonderful. Mike, please. I think all of us would be, thrilled if there was CNAs for hospice. We only work with CNAs, as caregivers. But I'm sure Amber and Darian would also be, very interested in, and absolutely, I think we're very flexible as far as being able to have some, part-time hours as well as full-time.
Okay.
Absolutely, it's needed. I will say that right now. The more that we can have out there, the better.
Good.
In the state of Wisconsin, we're unable to hire anybody that is under the age of 18. So if they're in high school, 16, 17 years old, and they are getting their certified nursing assistant certification, we're unable to hire them until they turn